Kenya. It's not put Kenya's. Here it is. Achha, it's come.
Excellencies, distinguished delegates, as I represent the Republic of Kenya's perspectives, the relationship between water and health has never been more consequential for our societies. As of 2023, only 59% of Kenya have access to basic drinking water services and merely 28% have access to safely managed water. These figures reflect structural deficits that continue to undermine public health, human development, and economic resilience. On one hand, the country has endured the worst drought in 4 decades, eroding water availability for millions. On the other, extreme floods in 2024 displaced more than 300,000 people, overwhelming wash systems and contaminating water sources. These extremes are aggravated by climate change and are becoming our defining reality. The public health consequences borne by water stress have been severe. Since the beginning of February 2025, Kenya recorded almost 15,000 cholera cases, and flood events in 2023 increased diarrheal incidents by up to 30% in affected regions. I want to emphasize that children accounted for nearly 30% of all the reported cases, and diarrheal diseases remains the second leading cause of mortality among children under 5. Furthermore, the burden of these crises is profoundly gendered. Women and girls in Kenya walk an average of 5 to 12 kilometers each day to collect water. This not only compromises their education and economic participation, but also exposes them to heightened risk of gender-based violence. Inadequate wash facilities during menstruation contribute greatly to school absenteeism and ultimately dropout. During droughts and floods, disruptions to water systems impede access to reproductive health, including maternal health services and family planning. Furthermore, stagnant water sources, where women often collect water, serve as breeding grounds for malaria, placing both mothers and accompanying children, young children, at risk. Kenya has established a strong policy foundation through the Cholera Elimination Plan 2022 to 2030, the Water Act 2016, and the National Water Master Plan 2030. Now, to fully operationalize these frameworks, Kenya requires targeted technical and financial support for the following areas. Infrastructure modernization to reduce the current loss, that is as high as 60% before even reaching consumers. Predictable, adequate financing, as Kenya has received only 27 to 34% of the requested resources for water and sanitation priorities. Strengthening regulatory systems to ensure effective disbursement and mobilization of the funds. Expanding laboratory and monitoring capacity, including establishing fully functional water quality laboratories in all 47 counties, and increasing hydrological monitoring beyond the current 300 stations. Strengthening of WASH human resources, as some counties have only 1 or 2 public health officers. At the same time, Kenya's experience demonstrates the value of decentralized, community-driven and indigenous solutions. The Marakwet indigenous irrigation systems, the Luo and Banyala water governance practices, and other traditional systems continue to provide reliable, climate-resilient water management rooted in ecosystem stewardship and community ownership. Revitalizing and adapting these systems to contemporary challenges offers a pathway to resilience that is both culturally grounded, ecologically resilient, and cost-effective. Excellencies, Kenya's message to the WWDR 2027 is clear. Water and health outcomes cannot be improved through infrastructure alone. They require integrated governance, climate-responsive planning, equity-centered approaches, and investments in both modern and indigenous systems. The global community must recognize that water insecurity is simultaneously a public health crisis, a gender equality crisis, and a climate justice crisis. Kenya stands ready to contribute to a global assessment that reflects these realities with clarity, urgency, and collective purpose. Thank you.
This is interesting. She is representing Kenya. Now I think we move from Kenya to Nepal, so somebody will come and talk about Nepal. Who is the representative of Nepal, please?
This
This is Syria. Nepal first. Nepal? Did you?
Distinguished UNESCO chairholders and esteemed delegates, good afternoon and namaste. We stand before you today representing the Federal Democratic Republic of Nepal. While our nation is often celebrated as the water tower of Asia due to our majestic Himalayas, a far more precarious reality exists at their base. We are here to bring our attention to the Tarai, our nation's breadbasket and home to nearly 11 million people. For 47% of our population, the majestic peaks are a distant view. Their daily survival depends entirely on what lies beneath their feet.
In the Tarai, groundwater is not just a resource, it is the absolute foundation of life. Over 90% of households rely on it for every drop they drink. However, we are witnessing a terrifying shift. According to the recent 2025 assessment, the drinking water crisis in the Tarai has escalated from 38% in 2022 to a staggering 46% this year. We are not just looking water quantity due to over-extraction, we are losing the biological and chemical safety of the water that remains.
This safety crisis is most acute in the Rajpur municipality of Rohtahot. A landmark study from December 2024 reveals a chilling reality. In Rajpur, only 28.9% of tested groundwater wells meet the WHO safety guideline for arsenic. This is a clinical emergency. In Rajpur, arsenic levels has been recorded as high as 0.220 milligram per liter, that is 22 times the WHO safe limit. The research shows that as our water tables drop, a reducing environment is created underground, mobilizing a lethal trio of arsenic, iron and manganese. Across the Tarai, roughly 3.5 million people are now consuming water that leads to chronic arsenicosis, skin lesions and long-term cardiovascular decay.
As a delegate of Nepal, we believe this crisis falls squarely within the mandate of Unesco ISP. We do not just need more filters, we need a science for policy intervention. The Rajpur study confirms that 80% of contamination occurs in shallow wells under 50 meters. Therefore, we call upon the ISP to support the transdisciplinary research initiative to map the safe deep aquifers across the Tarai. We need UNESCO's expertise in hydrological modeling to ensure that when we dig deeper, we are assessing sustainable, arsenic-free water for our rural schools and health sectors.
Furthermore, we request the UNESCO World Water Assessment Program to integrate this Tarai crisis into their global water health education framework. We need UNESCO-supported water literacy programs in our local schools. The 2024 data show a direct correlation between high iron manganese levels and arsenic. We must empower our communities to recognize these physical makers. By connecting UNESCO's scientific resources with our local governance, we can move from reactive filtering to proactive protection of our most vulnerable citizens.
In Rajpur and across the Tarai, the water looks clear, but the danger is transparent, though the threat is invisible to the naked eye. The consequences for our people are devastatingly clear.
We stand before you all, not just to request for charity, but to propose a strategic, scientific and educational alliance, a partnership of expertise that only UNESCO is uniquely positioned to provide.
For the health and the future of 11 million boys of Tarai, and on behalf of Nepalese, we thank you for your commitment to our shared future. Thank you.
Good.
Thank you very much. I think the ladies, the representative of Nepal, provided a very interesting contrast between what is happening in Tarai and, of course, what is happening in the Himalaya. And, of course, we'll take your suggestion into consideration when we will draft 2027 World Water Development Report. Now, without further ado, I'd like to ask the representative of Nigeria.
very warm good morning to all the members present here. Thank you for giving me this opportunity to represent the Federal Republic of Nigeria. The total population of
बच्चे सब
Nigeria
एक ही
is
दिखते हैं
nearly
नहीं, ऐसा लगता है
227
सबके सब हिंदुस्तान
and
के
out of
हैं ये
that,
सब.
60 million population lack access to safe water and clean water. Nigeria recognizes water security as the foundation of public health, economic stability, and social equity. As Africa's most populous nation, Nigeria faces scale-driven challenges in providing safe water and sanitation. Inadequate wash and unsafe wastewater management continue to accelerate preventable diseases. Climate variability has increased floods and droughts, placing additional stress on water health system. Nigeria supports integrated engineering-based and evidence-driven solutions to address these challenges. The key challenges we face today as a country is that nearly 50% of the health facilities lack continuous on-site water supply. The water availability is way below the WHO minimum standard of 5 to 10 liters per person per day, and the absence of standardized wash performance indicators at facility level. 80 to 90% of municipal and hospital wastewater discharge are untreated, and there is a very high BOD and COD levels, which is nearly 200 and more than 200 milligram per liter in untreated effluents, which causes high health risks like cholera, typhoid, etc. The presence of antibiotic residues enable the AMR selection, and the lack of hospital wastewater treatment systems also accelerate the diseases which is on a rise in my country. The presence of excess total solids, total suspended solids, nutrients like nitrogen and phosphorus causes eutrophication. Heavy metals like lead, cadmium in industrial and urban wastewater are very difficult to treat, and the lack of sufficient treatment plants is a very major problem in my country. Flood contaminate drinking water sources and sanitation systems. Borehole contamination when flood depth exceeds 0.5 to 1 meter. Diarrhea diseases incidence increase 2 to 3 times post flooding, and the drought reduces water availability for hygiene by 30 to 50%. Now for key solutions, Alok will tell us more about that.
Key solution: strengthening wash in health facility. Ensure greater than 5 liters per person per day water supply with peak demand consideration. Install redundant water system. Source storage and backup. Apply who was fit for routine technical audit. Allocate greater than equal to 30% of life cycle cost to operational and maintenance. Wastewater treatment and AMR control. Mandatory on-site pre-treatment for hospital wastewater. Deploy low-cost decentralized treatment system. Anaerobic baffled reactors. Constructed wetland. Targets greater than 90% removal of BOD, pathogens and antibiotic residues. Water quality protection. Enforce effluent standard for BOD, COD, TSS, nutrients and heavy metals. Increase water quality testing frequency to WHO recommended levels. Climate resilient water infrastructure. Flood resilient boreholes. Design raised platform greater than 0.6 meter. Sealed well heads. Decentralized wash system for crisis functionality. Integrate new nature-based solutions. Data innovation and equity. Deploy digital sensor, turbidity, residuals, chlorine, conductivity, mobile-based reporting system for health and water staff. Integrate water quality, health and climate data set. Ensure gender disaggregated and rural focus indicators. Engage universities, youth and local innovators to monitoring. Thank you.
Thank you very much. Thank you very much, President of Nigeria. I think it looks like Nigeria has a lot of things to worry about, and I hope that we'll be able to include some of the concerns that they have raised in the 2027 report. So from here we move to Papua New Guinea. Representative Papua New Guinea.
Papua New Guinea.
Distinguished Chair, Excellencies, ladies and gentlemen. Good afternoon, Dina Namona. Papua New Guinea joins this session on water and health with a clear message. Water and sanitation are urgent health issues, not abstract development goals. In the Pacific, our realities are stark. WHO and UNICEF report that 5 million people still lack basic drinking water services. UNICEF Pacific wants that safe wash is a critical issue across the Pacific, with major gaps, putting children's health and future at risk. We therefore welcome World Water Development Report 2027's focus on the water health nexus, but we urge that these high-level things translate into concrete action for our region as well. In Papua New Guinea, specifically, the situation is dire. Waterborne and sanitation-related diseases are already one of the leading causes of deaths for children under 5 years. Preventable illness from dirty water and poor hygiene kill our children daily. 76% of our people lack safe toilets, and 66% have no clean drinking water. Rural-urban disparities are extreme. Only 45% of rural areas have basic water supply compared to 90% in cities. 87% of our population lives in remote areas, making this gap extremely harmful. So we can see a statement made by a healthcare sister on the presentation as well. Sometimes when there's no water in the center, we tell pregnant mothers to bring their own water for use during delivery. So from this situation, you might be able to imagine how dire the situation in Papua New Guinea is. And believe me, these are not just baseless statements, but I present you the facts based on the United Nations reports and World Bank reports. Climate change is compounding our problems. Papua New Guinea is among the world's most climate vulnerable nations. Rising sea already threatens our coastal villages. As one Carteret insider described, when sea level rise, salt water can infiltrate water supplies, making water undrinkable. Inland communities now face more extreme droughts and floods. In Rigo district this year, UNICEF and partners have already installed a solar-powered pumps after a vulnerability assessment found intensive droughts, poor water quality, and inadequate sanitation. This system now delivers safe water to 250 households, local schools, reducing the community's vulnerability to worsening droughts and floods. This climate stresses deepen our water and health challenges. Our solution must be long-term and local. We must expand rural water and build national capacity. That means drilling more boreholes, building rainwater tanks, upgrading village sanitation, and above all of that, training our own engineers and health staff. We echo United Nations strategies to strengthen governance and national systems so Papua New Guinea can manage vast sustainability. Nowadays, in Papua New Guinea, we just say, do not build solution for us, build our capacity, and Papua New Guinea wants to lead. We ask partners not just for aid, but for tools and training. International donors should help us build pipelines and empower communities, not just supplant our leadership. Regional cooperation and respectful financing are also crucial. I recently spoke with the delegate from Fiji who shared how joint projects are upgrading dozens of clinics with climate-resilient water and sanitation facilities. We learn from each other and we invite joint Pacific solutions. At the same time, global partners must respect our ownership. In the line with SDG 17 and Paris principles, it should support our national plans and not bypass them. We want partnerships that builds Papua New Guinea leadership, not parallel systems, and that can be scaled across the Pacific. In closing, the case is clear. Water is life and health, and this assembly must move beyond words. Our Deputy Secretary of Planning observed about a village water project. Providing clean and safe drinking water is where it starts. And if we start now, we save lives and strengthen resilience. We urge UN member states and partners to return upgrading health facilities across Papua New Guinea, and our people are ready to work. They just need support and tools to work and succeed. Thank you.
Oh God, very nicely present. Oh my God, they're so
Thank you
touching
so much.
stories.
What I will do is, because the ambassador of Papua New Guinea is a friend of mine, and I'll make sure that whatever statement that you have read, I will forward it to him. And perhaps he will invite you to perhaps like consult with you. And one of the things that I must say is, amongst this maybe about 15 odd students who are participating in this exercise, One of them I plan to invite, to work with us in Perugia, in Italy, where our headquarters is. So perhaps they will also have a bigger and higher level responsibility to go beyond being representative of a country and become representative of the world. So I think I look forward to working with you guys. So now Syria, I think you next, or Peru is the next. Peru is not there. Okay, so Syria.
This fellow is sitting there. He has to change. Gappa mara.
Distinguished Chair, Excellencies and fellow delegates. As we convene to save the 2027 World Water Development Board, the Syrian Arab Republic brings to this floor a reality that is, it is stark as it is urgent. In the 2027 landscape, water is no longer just a resource. It is a thin line between a recovering nation and a systematic collapse of public health. According to the WHO, 15.8 million Syrians, nearly 65% of our population, remains in dire need of essential health assistance. We are not here to discuss water in isolation. We are here to discuss the reverberating effects of conflict and climate on the very body of our citizens. The triple crisis, climate, infrastructure, and disease. Syria serves as a global case study for the themes outlined in our concept note. First, consider climate resilience. The 2024-2025 season marked the worst drought in 36 years, with cumulative rainfall totaling a scant of 94.9 mm. Our primary lifelines are vanishing. The Fiji spring, which has sustained Damascus for millennia, has dropped to 12% of its historic flow. When the earth dries, the health crisis ignites. Second, we must address infrastructure paralysis. The second concept, the concept note highlights that 50% of global facilities lack basic water. In Syria, our water system operates at 49% capacity, but during the frequent power failure that defines our post-war transition, this limits to a catastrophic 22%. Third, this leads to what we call the dual burden healthcare crisis. Only 57% of our hospitals are fully functional. In these facilities, water is a medical requirement that we cannot consistently meet. This infrastructure failure has a direct health signature: acute diarrhea. Now accounts for 20% of all cases in our disease surveillance system. We are fighting 19th century waterborne pathogens like cholera and hepatitis A, while our 21st century health system struggles to provide dialysis for patients with renal failure, a treatment that is impossible without high purity water. The gender experience. The silent engineer. The Syrian delegation insists that the 2027 report must adopt a gender disintegrated lens. In our nation, women have become the silent engineers of survival. As the primary managers of household water, they bear the physical and psychological weight of water scarcity. When water must be purchased from unregulated tankers, it consumes up to 25% of household income, driving women into hygiene poverty. The lack of sterile water for menstrual hygiene and maternal care is not just a wash issue. It is a fundamental violation of right to health. We cannot talk about water and health while the specific biological and social need to women remains a footnote. Our proposal: integrated governance and depoliticalization. To address these challenges, Syria proposes a radical step in the 2027 framework: the multi-sectoral task force. We recommend that UNESCO advocate for a national water health task force, NWSTF,
Water management can no longer stay in the hands of engineers alone, nor health in the hands of doctors. In Syria, we propose a co-governance model between the Ministry of Water Resources and the Ministry of Health, ensuring that every water station is treated as a primary healthcare outpost. Solarization and early recovery. To bypass the 22% capacity trap caused by energy shortages, the 2027 report must prioritize the solarization of water health infrastructure. We must move from emergency water trucking to structural restorative engineering. Water is not a weapon. Excellencies, the World Bank estimates that the reconstruction of our statutory infrastructure will cost $216 billion US, but we're not just asking for funds, we're asking for depoliticization of water. Under the spirit of UN Security Council Resolution 2573, water and health must never be used as a tool of political leverage. We demand the lifting of all unilateral measures that prevent the import of life-saving water treatment technology and medical supplies. Let the 2027 Unesco report be the document that finally recognizes the health security is water security. In Syria, we have learned the hard way that when the taps run dry, the hospitals fall silent. Let us choose a future where water is a bridge to our recovery, not the casualties of our conflict. Thank you.
Excellent.
I think many of you know that there are two countries that these young students have chosen. Syria and Yemen are considered as the countries with worst humanitarian crisis that is happening right now.
Yeah.
Both in terms of their livelihood, but primarily in terms of water supply and sanitation. So congratulations for picking these two countries. So the final presentation will be on Yemen, and the whole idea is, one of the students have already consented to coordinate everything, and she will draft a consolidated report, and this report will be signed, of course, by Ramakar Chahs, and then it will be sent to the UNESCO office as a contribution of this conference. So whether you like it or not, this is going to be a major step forward in the right direction. So
Good, that should be the outcome. That's what is required.
That's on the ground out.
Otherwise, you do within the four walls, nothing comes out.
Honorable Chair, distinguished delegates, and respected attendees, the delegation of the Republic of Yemen approaches today's discussion with a question: why do over hundreds of people continue to die annually from cholera in Yemen, despite years of international intervention and humanitarian presence? Yemen's water crisis is often framed as a consequence of conflict of climate change. While these factors are of course significant, such explanation risk obscuring deeper structural failures in water governance and public health outcomes. Yemen is one of the most water-scarce countries in the world. The nation has no permanent rivers, and per capita renewable freshwater availability is under 100 cubic meters per year, which falls below the water poverty threshold. Over 14.5 million people lack access to accessible, safe drinking water and sanitation, a figure largely unchanged despite extensive humanitarian programs. Just between March 2024 and August 2025, WHO reported over 330,000 suspected cholera cases and more than 1,070 deaths. These are not just merely statistics, they represent life lost due to preventable disease. This persistence raises a critical question. Why does the response prioritize emergency treatment rather than prevention? The dominant humanitarian model funds short-term cholera response, treatment centers, oral rehydration points, and vaccination campaigns, while long-term investments in infrastructures and institutional capacity remains very underfunded. The numbers itself reveal the problems. As of mid-2025, only 14% of health sector requirements and 7% of WASH needs were fulfilled. Preventive programs have been very scaled back, while emergency services remain overstretched. These epidemics reflect broader system fragility.
Decades of conflicts have damaged water treatment plants, pipelines, and sanitation networks. Health facilities remain underfunded and overburdened. Without sustained fuel supplies, even existing water stations cannot operate reliably. The human toll is greatest among the most vulnerable. Children under 5 face heightened risk from contaminated water. Poor water exacerbates malnutrition, weakening disease resistance. Water insecurity also undermines education, economic participation, and community resilience. The delegation of Yemen underscores that water security and public health are inseparable. Without clean water, no health system can function effectively. Yemen's experience demonstrates what must change. The water health nexus requires integrated risk planning, not sectoral responses. Mobile health wash units combining water access with disease surveillance can break transmission cycles. Solar power decentralized treatments eliminates fuel deficient dependency, while community-led early warning systems enable prevention and not just reaction. Technical capacity determines sustainability. Regional training initiatives can reduce dependency on external actors. Climate adaptive solutions that rehabilitate traditional rainwater harvesting while integrating modern filtration combines indigenous knowledge with appropriate technology. Yemen calls upon the international community to take coordinated action. We would like to call on the World Health Organization to scale up funding for integrated wash health responses, including infrastructure rehabilitation with multi-year commitments that enable prevention. We call on the UNICEF to expand access to safe drinking water for conflict-affected and displaced population, and especially children, recognizing water access as inseparable from disease prevention. We would like to call on UNDP to strengthen technical capacity through regional training and technology transfer. We would also like to call on UNHCR to ensure provision for safe drinking water and sanitation in refugee camps and settlements in conflict-affected areas. Finally, prioritizing sustainable solution and integrating water security with climate adaptation and community resilience is very important, and for that, youth voices and local knowledge must be acknowledged. Incorporating youth-led initiatives like Youth for Water and Sanitation in Yemen, who have demonstrated the critical role of youths in promoting water conservation and local health prevention is very important. Finally, Yemen would also like to call on UNESCO's World Water Development Report 2027 to examine these structural patterns and provide evidence-based guidelines and financing mechanisms that enable prevention infrastructure in water-stressed, conflict-affected countries and contexts. Honorable Chair and distinguished delegates, safe water and functional health systems are fundamental human rights. In Yemen, the lack of both costs life every day, particularly children's life. The cycle of preventable disease and suffering will persist unless we all act collectively. Yemen urges this body to move beyond short-term interventions and commit to evidence-based solutions that restore health and strengthen resilience. The delegation of Yemen stands ready to work with all partners to transform this crisis into collective action that saves life and upholds human rights. The time to act is now. Thank you.
Excellent. Children are doing good.
Thank you very much. I think we heard all the way from Bangladesh to Yemen, and this was, I think, about 10 very powerful speeches that these young people could provide. Unfortunately, the participation on the part of Indian side was a bit weaker. Although I was the first one to arrive about 3 days ago. Spoke to them, but I think they were somehow engrossed and taken away to support the different administrative side of the conference, which is also equally important. But I think I basically wanted it to be equal, 50-50, but unfortunately it looks like the young people from Nepal who actually came essentially as a savior and carried the session forward. So congratulations, and then congratulations to a few of you, who actually participated from the past side also. Indian presentation, I would in fact rate it as the best. So I think wonderful. I really loved it, and I think that was very nice. What I really want is, I want Professor Singh to finally conclude on this. Just to provide that, what we heard from these young people, And whether or not a practice like this should be considered in a program setting like this.
Okay, thank you very much, Manu. First of all, I'd like to congratulate every speaker who represented a particular country for making an excellent presentation. And second, I would like to congratulate and thank Dr. Bhanu Newpan for providing this opportunity. I think this is one of the best things I have really heard. This is the first time that I witnessed this kind of event, because I've never seen, even though he and I have been at several conferences, but I don't think he ever provided this kind of opportunity before. So I think all the speakers should really be grateful to him, to Dr. Newpan, for the opportunity which he afforded them. But coming back to the presentations, I was very impressed by the way they made the presentations, and there are a few key points which I would like to mention that struck me. First, it's very important to recognize that water and health are integrated. But more importantly, really there is a very close nexus between water, energy, environment, health, and society. These really form a very close nexus because they are interrelated to each other. And I've been thinking about it, and I have also been personally involved in working on this nexus. Normally, actually, if you recall, I think, Bhanu, you might recall many years ago, the Stockholm Water Prizes was given to a Britisher who only considered water, food, and energy nexus. But I think that nexus is, in my view, is incomplete. So the nexus should include not only water, food, energy, but also equally important is environment, climate, and society, as well as, of course, the health. Without society, we cannot, in all fairness, develop this nexus. Because after all, it is the human beings who work on the nexus, who establish the nexus. But coming back to what they presented, so first, there was a great deal of emphasis on water and health. But I will go a little further. Really, water means water security, which means both quantity and quality. Because by definition, water security means access to quality water in adequate quantity at affordable cost. So here the quantity is involved, the affordability is involved, which means everybody should be able to afford quality water. Now look at here, look at all over the world. Now I never realized when I was growing up that we will be drinking water by paying money. Now, you go out and you have to pay 15 to 20 rupees depending upon where you are, just for a small bottle of water. So affordability is equally important in order to ensure water security. So the security, and of course the emphasis was water and health, but essentially they were implying water security and health. But also the presentations, some explicitly, some implicitly, really brought out this nexus, meaning relating to energy, relating to food, and relating to climate as well as to society. That was one thing. But equally important point was the interdisciplinary or multidisciplinary nature for addressing this issue of nexus. And here, the multidisciplinary, the way I interpret it, is not only professionally speaking, interdisciplinary participation, but also participation on the human level. That is the participation or nexus amongst academia, government, and other professional organizations like international organizations being represented by my colleague. This is really very important, and international organizations like UNESCO can take a lead in setting up an example. UNESCO is not supposed to provide huge funds, and perhaps it does not have use to support the work, but it can certainly provide, it can set the direction, it can take a lead in showing the way, and that I think is the primary mission that he's trying to exemplify, he's trying to portray. So those are the key points. The other thing which also impressed me was that these students chose the countries which are not necessarily the choice countries across the world. If I were to choose, I'm not sure I will choose Yemen. But somebody really had the courage to choose Yemen. I would not have chosen Syria, given the current conditions, or the conditions that have been prevailing in Syria for the past, or more than a decade. And Syria is in a very, very bad situation. But the students chose Syria, and these students really made excellent presentations, and they made excellent points. So without further ado, because I think you are already getting late for lunch, these are some of the things that came to my mind. But more importantly, these are budding engineers, these are budding people. These are the people who will become the leaders of tomorrow. These are the people on whose shoulders will fall the burden or the leadership of the country, and for that matter of the nation. Another point that also came to my mind is water can serve also before that. Actually, if you look at the statistics on the prosperity of water security and the economic well-being of nations, you will find that those nations which are doing well when it comes to water security are also prosperous nations. They are also prosperous nations, and you can find a direct correlation between water security and economic prosperity. So then the next thing that I would like to emphasize is water actually can serve as a basis not only for enhancing the prosperity of a nation, but also it can serve as a bridge among the different nations. In other words, it can bring other nations together and develop a partnership, hopefully leading to a more prosperous, coherent, and congenial world. And with that, I would like to again congratulate Manu and all the students really for engaging in this very interesting discussion and dialogue.